your implant may push the Schneiderian membrane or the maxillary sinus floor membrane to some extent, or in some cases it may penetrate the membrane also. What's going to happen when there is a penetration into the maxillary sinus through the membrane? If the penetration is up to 4 mm or sometimes more than 4 mm, when the 2 to 3 threads of your BECS, that is a polished surface cortical implants, is inside the sinus. So what are the side effects the patient may experience after the placement of the implant? Sinusitis or epistaxis into the nose. These are all the complications may occur, but usually these complications will not occur if the implant length penetration is up to 4 to 6 mm. I have seen many cases. I have done in full mouth cases push the implant into the maxillary sinus. Many implants have been into the maxillary sinus up to 3 to 4 mm. So I have a cases of 3 to 4 years or 5 years follow-up cases. All the patients are fine, no post-operative complications, no infections inside the maxillary sinus, no sinusitis, so no polyp or no mucosal or no granuloma tissue formation. So no side effects are there. So most of the time nothing going to happen, and the implant success rate also will be good. So what's going to happen when you're going to penetrate into the nasal floor? So here in the nasal floor we have to engage into the cortical bone, that is the D2 bone. So we have to penetrate the nasal floor, perforate the nasal floor. During the perforation, it so happens that your perforated the tip of the implant may go into the nasal cavity, that is the floor of the sinus. Sometimes for some patients there may be epistaxis or the nasal bleeding, so it's limited. So usually there will be droplets of blood, so because of the penetration into the nasal spine area. So this complication can be manageable. So this epistaxis is manageable with the pressure with your finger or the application of any the placing the cotton swab inside the nostrils. It will stop for some time, it will be there, it will stop for sure. So we have to perforate the nasal floor while placing the corticobasal implants. Here also I want to emphasize more that what is the effect of penetration into the nasal floor area. So usually in most of the cases when you perforate the nasal floor, nothing is going to happen. Here the implant of choice should be the smooth surface, that is the bicortical screws or BECS. Rough surface implant also I do place, nothing is going to happen. I will perforate always while placing the implant in the nasal floor, so nothing goes wrong. Even though if it is perforated more into the nasal cavity area, there will be epistaxis to the limited extent, will be droplets of blood that will stop by itself. So no, not much complications will not going to happen. Have done many cases in missing anterior teeth in the full mouth cases. Have penetrated most of the time, will penetrate the nasal floor and place the implant into the corticals, so have not come across any complications. So here I want to emphasize that when there is an atrophy in the maxillary sinus area in the posterior maxilla, and when you are going to penetrate in the nasal spine area, even though if the implant pushes or lift the maxillary into the maxillary sinus area, that is it's going to penetrate the maxillary sinus, it will going to penetrate the membrane and enter the maxillary sinus area, and the length of penetration may be less than 4 mm or more than 4.5 mm. Nothing is going to happen. Side effects will not happen most of the time. So usually the side effects which going to happen if there is a more penetration, I have explained. So these complications are manageable also. So the final wording here is that even though there is a penetration into the maxillary sinus, or when you are going to place an implant in the nasal spine area, little bit of penetration of up to 4 mm in the maxillary sinus area, and in the nasal spine area up to 6 to 8 mm. So penetration into the sinus area will not cause any kind of complication to the patients. So unless if there is a compromised case wherein the length of penetration is more, then you may come across complications. Otherwise, no issues if the implant penetrates the sinuses. Thank you.